I am an orthopedic surgeon at Panorama, practicing primarily sports medicine. I wanted to be a doctor before I even knew why I wanted to be a doctor. I went to high school already preloaded to be a doctor. It's what I wanted to do. I loved science, I loved people, I loved kind of the potential that the career had, and I knew literally in high school that I was going to be a doctor. I was already on that track. So when I went to University of Michigan, I was already pre-med from day one. There was really never any other career choice that was even a possibility. I went to med school thinking I was going to be a pediatrician. As I started my rotations, my clinical rotations, I quickly knew that I really wanted to be a surgeon of some sort. And then I started going down the checklist of what surgical subspecialties really interest me. My last rotation, third year of med school, was orthopedics, and I fell in love with it and really never looked back. It just appealed to kind of my interests, my lifestyle. I loved the surgery, I loved the patients, and it was a very easy decision, an organic decision from that point forward. You know, I've taken care of really athletes at every level, from kids first day on skates to professional athletes. As part of a fellowship training, most of us take care of very high level athletes, you know, pro, semi-pro, international athletes, which I did through my fellowship. And then I actually started my career at Northwestern. I went back to Chicago and practiced on faculty there. And the group I was with took care of the Chicago Bears and the Chicago Blackhawks, and at that time the Chicago Bulls. I love taking care of kids. I think, you know, we are primarily an adult orthopedic group. I love taking care of kind of adolescent sports medicine injuries in that, you know, 12-year-old and up range. And I've done that my whole career and will continue to do so. And I have kids and I raise kids and I take care of all of their friends, and I've seen, you know, much of Evergreen in my living room for bumps and bruises. I love orthopedic surgery as a specialty. I think it is the best place to be in medicine. It's an incredibly rewarding, satisfying career, really. We see beginning, middle, and end of treatment. We have a lot of happy patients. We have incredibly motivated patients. We fix problems. It is a very fixable, you know, subspecialty, really. I've really been incredibly active and athletic my whole life. I'd say I'm kind of jack of all trades, master of none. You know, I played organized sports through my high school years. I do a lot of mountain biking in the summer, a lot of snowboarding in the winter. That's a big part of my free time. We love to travel. My wife is a former Joffrey ballerina, very artistic, very creative. So we're always kind of doing interesting things, taking interesting trips, learning how to dance tango, eating interesting food, and that pretty much fills my plate.